Healthy Show. This Friday, May the 4th be with you. I had to do that. Well, tomorrow's Revenge of the 5th, so someone told me I'm not a big Star Wars guy, but I just want to do that. I want to welcome onto the program today. This evening, we're going to have two respiratory therapists on the program. In studio, we got Ed Salazar with All County Healthcare. Ed, how are you?
Very well, thank you. Good to see you again.
Thank you for coming on the show on this adventure of health. And then on the phone, calling in all the way from Cape Coral, Florida, we have Mr. Bob. Bob, I should have asked you how to say your last name. It's Bob Subkowiak?
It's Bob Subkowiak.
Subkowiak. Not a very good journalist right here, not asking you the phonetic pronunciation of your name.
Hey, Bob, how you doing?
Hi, Ed. Good speaking to you.
Good to talk to you again.
So as Ed knows, we talk a lot of COPD on this program. And Bob, I had met you briefly in the studio, and thank you again for sending the pamphlet over on 2-day airmail there. I appreciate, and we'll talk a little bit about that. But we hear the acronym all the time. But what is COPD exactly? Because coming from a respiratory therapist is going to be much better than what I have to say.
Well, the acronym stands for Chronic Obstructive Pulmonary Disease. And basically, it's a condition that is progressive and tends to get worse in terms of symptoms unless someone takes action to slow down that progression. And airway obstruction is a major problem. There's difficulty in getting the air out of the lungs. And it's definitely a big problem in the United States and increasing.
It is, and I always I preface this by that commercial, the elephant sitting on the chest, and I think there's another commercial out now. Do people, I know you do a lot of awareness, and you're a respiratory therapist as well, but you do a lot of awareness with the organization, but do people tell you it's like they have like an elephant or something on top of their chest?
Well, that makes for a good commercial, but actually what we really see is more of a subtle process. We see a chronic cough. We see a chronic sputum production that increases. Usually we see it in the age of 40 and on. We see a shortness of breath that becomes worsened over time and pretty persistent. And that shortness of breath gets worse on exercise and worse when a person has a respiratory infection.
I see. And now tell me a little bit about the COPD coalition.org. Did I say that here? I have it right here. COPD Breathe Strong America, and you're the COPD coalition coordinator. So is that more on the side of awareness, bringing out of what COPD is and letting Americans know? Maybe, they think a lot about, obviously, heart diseases in the news. Cancer's always in the news as one of America's killers, but COPD, I think we said it was a third leading cause of death in the U.S.
Well, it depends on who you talk to.
Yeah, we went through a whole segment on that, right?
It had been the third leading cause of death in the United States, but medical errors is now number 3.
That's right.
But chronic lung diseases are, I believe, it's number 4. Is that what you is that what you think, Bob?
Yeah, I believe recently medical errors has passed it recently, but in terms of medical errors, one of the things that we talk about with people with chronic lung disease is you want to reduce your risk of unnecessary hospitalizations where that risk of medical errors, that exposure could also be a link. So it's definitely something to be aware of, that you want to be able to do as much for your self-management of this chronic disease and stay at home as much as possible and out of the hospital.
Now, where does COPD Breathe Strong America come in? Is that, like I said before, is that an awareness campaign?
Yeah, basically it developed over the last few years from the United States COPD Coalition, of a partnership of organizations the COPD Foundation, the Alpha One Foundation, which is dedicated to a certain type of genetic form of emphysema, the people with the Lung Association. We try to partner together, both providers and patients together in this coalition. And you're correct, David, that awareness is a big factor of it, along with education and research. And basically what we try to do is help support groups, strengthen support groups for chronic lung disease, help pulmonary rehab programs have information to support, and testing, getting people tested for COPD. If you have those symptoms we talked about earlier of that chronic shortness of breath, chronic cough, exercise creates more difficulty for me, any activity, they need to be tested. And that awareness to be tested is very important. And what we've really found is that helping people just become aware that it's not just my age or maybe putting on a couple of pounds, but it might actually be an airway problem that needs to be tested and treated.
And we're here with Bob Subkowiak. Did I get that right that time? All right.
You did good.
Close
good
enough.
Job, David.
Respiratory therapist with COPD, Breathe Strong America. He's a COPD coalition coordinator. And Ed Salazar, respiratory therapist with All County Healthcare. Ed, you had a comment.
Well, I was going to follow up on what Bob was saying about diagnosing the problem. It's amazing, even today, how many people have never, that have a history of cigarette smoking or have been in an occupation, where they might have compromised their lung function, and have never had a simple spirometry test. Now, spirometry is simply a one-breath maneuver where someone inhales as deeply as they can, blows it out as hard and as fast as they can. And there's a lot of different parameters that can be retrieved from this simple test, and they can give a strong indication that someone might likely, have a chronic lung condition. Those people that are high probability then can go on and have a complete pulmonary function study. But the thing that I'd like to note, and one of the things that Bob's organization does a good job of, is educating people in early diagnosis, early treatment. And every primary care physician, well, I shouldn't say every, but many primary care physicians have the ability to do this spirometry test. You don't have to be seen by a pulmonologist. But depending on your results, you may be an indication to be referred to a pulmonologist.
I see. And then from there, the pulmonologist obviously works closely with respiratory therapists and pulmonary rehab team as well to get you on a path, not so much of recovery, but more of maintenance and keeping what you already have. Because one thing I heard about COPD, and I think we've discussed this also before, is once you have it, you have it. There's like no cure. Like you can't take a pill and get rid of this kind of thing.
That's right. In my opinion, you can't cure it, but through a judicious use of medications and different technologies that are available, pulmonary rehab programs, you can make what's left more effective.
That's what I was going to ask you next. Like, can lifestyle factors raise? I want to ask that later. But can having a pulmonary rehab program, having a focus on this, working with the right team, actually help you maintain and a better quality of life? Bob, what do you think about that?
Well, I think Ed's correct. That once a confirmation spirometry is done to determine I do have that airway obstruction, there are a number of things that can be done. Pulmonary rehab is a program designed for exercise and education and helping that patient get on that track of wellness for people, for a better term, like a wellness program for people with chronic lung disease. But we should note that there are insurance and Medicare guidelines that require you to have what they call moderate to severe level of lung disease before you qualify. And what I think Ed's point was well taken. We don't want to wait till you get to be very severe. We want to get it at mild. And even though you may not qualify for a pulmonary rehab program formally, we try to educate people on things you can proactively take charge to breathe. Well, that's how our name, Breathe Strong. We want people to breathe strong and take charge of their symptoms and management through daily exercise, taking your medications regularly. Ed's device, the IPV, is a great tool to help clear the airways. And we want to make sure that patients are in charge of the different devices and tools, make good choices for them, because everybody's different with different needs for the right device and medication to help them in managing these symptoms.
You mentioned the IPV. Ed, tell us a little bit about the IPV that Bob's talking about that All County Healthcare has, and then I'll ask Bob a follow-up question.
Okay, what we at All County try to do is to prevent exacerbations. And an exacerbation is when somebody's symptoms of their COPD become so overwhelming that they can't. They're basically in respiratory failure, and it requires them to be hospitalized. What we at All County do, we use this intrapulmonary percussive ventilation device to enhance the effectiveness of a patient's cough, to help them mobilize secretions and to ventilate those areas of the lungs that become poorly ventilated as a result of their obstructive problem. And I'm sure Bob can back this up, but when we were younger, much younger, respiratory therapists, and we were working night shifts
at hospitals.
At hospitals, correct. Between the witching hour was always like 3 a.m. to 5 a.m. And that's when all these patients with high acuity COPD would get into trouble and come into the hospital and have to be hospitalized and then rigorously treated to restore their baseline health.
Is there a reason why in the middle of the night?
Well, all of us, healthy people, unhealthy people, once you fall asleep, not only does your respiratory rate slow down, but your tidal volume or the depth of your breathing slows down. So if you've already got a lung disease, this doesn't bode well for you.
Oh wow. Okay, so that's the time.
It seemed to be.
And just to chip in there on Ed's comment, I think that what we've noticed too is that the first thing in the morning, like that early morning time, and the last thing in the evening, people with chronic bronchitis and the tendency to accumulate secretions, those are the two times that those airways get clogged up more with mucus. And the other thing that goes right along with the airway clearance is oxygen. With that lack of breathing, it's very important that the patients be assessed for their oxygen needs as well, to make sure when their airways are narrowed or inflamed or restricted, you want to make sure that I'm getting enough oxygen into the blood.
I see. Now, going back to IPV, Bob, you had mentioned it. Have you helped people out with this IPV machine over there on the west coast of Florida?
Over the years, I've used IPV very much on both surgical patients and medical patients who have difficulty removing secretions, and very successfully, especially those patients who have difficulty, as Ed mentioned, having an effective cough. I've seen it work tremendously over the years, and I think one of the things that Ed and I have both seen too is that there's a tendency that we'll use a device when we're actually have a chance to have that physical contact with it. I think one of the big problems is that just like COPD, in general, there's a lack of awareness many times of providers of the benefit of Ed's tool in terms of the prescription and awareness of an ordering physician to say, wow, I better look at that other device in my tool bag that might help the patient, because they might be used to other devices that are more familiar with. They are more familiar with.
Now, Ed, this interpercussive device, it actually is something that used on a daily basis to break up the phlegm, mucus, and the stuff that's congesting the patient, so it's something that they can use every day for a certain amount of time? And the second part of that question, remember that, but second part is, how come, like he said, more providers, more hospitals just don't get it and get this machine?
Well, the therapy itself, it works on a high frequency percussive. A lot of people that have COPD or know someone that has COPD may have seen in the hospital the patients get treated with a therapist will, percuss on their back to help them mobilize secretions. Well, this technology does the same thing, but it does it internally at the same time. It gives them their medicated aerosol. As to why it is not used more universally, the blunt truth is money. Right now, in hospitals, there's no problem with the hospital being reimbursed for the therapy, but in the home setting, right now Medicare will not authorize payment for it, even though there's all sorts of evidence to prove its efficacy.
To keep people out of the hospital.
Readmissions for COPD is a huge problem with Medicare right now, and there's an enormous initiative to try to reduce this. And companies organizations like Bob's do their very best to educate the patients on proper utilization of what's available to them, primarily medications, pharmacologic interventions. Over the last 20 years, millions and millions of dollars have been poured into pharmacological research for COPD, and many, many drugs have come out, different types of steroids, dilators, antibiotics, and combinations of these medications, but outcomes haven't improved at all. So, what we believe is that what we do with the IPV is physical medicine, and this physical medicine, in conjunction with their pharmacological prescriptions, is going to do a much, much better chance of a better job of keeping them out of the hospital. And at All County, the reason I'm working with All County is that they are the only Medicare home health agency that has been willing to invest the money into the technology to provide it for their patients.
Okay, and patients all across Florida, just in South Florida, can get this kind of treatment?
Well, right now in the state of Florida, it's only available, All County is a tri-county home health agency. So they are licensed in West Palm Beach, Broward, and Dade County. So patients in these locations, have access to it if their physician will prescribe it.
Okay, that's good to know. Bob, I wanted to ask you before, and I kind of glossed over it because I was excited. We were going back and forth about COPD. I got two respiratory therapists in studio. So I wanted to ask you a little bit about the Florida Breathe Strong patient education guide that you sent over. Now, what is it, and how can people get a copy?
Well, basically, it's a guide that we've put together after having about 7 years of community workshops to try to. My best analogy would be when you go to Walmart, there's a greeter, and basically, I'm a greeter. I view myself as a greeter. Welcome to the COPD community. Let me take you through the store of what we can do to help and serve you. And this guide serves as an introduction to that person who just has a new diagnosis of COPD, and we take them through in this guide all the different things that they need to be aware of to help themselves of breathing techniques for preventing flare-ups, using things like harmonica devices to breathe stronger, those medications that Ed was referring to, information about the differences between the different types of medications, how to stay active with walking, home exercises, because not everybody is able to get into pulmonary rehab. If we have 16 million people with COPD in the United States, if every pulmonary rehab program in the country was fully to capacity, we'd serve 10,000 patients. So we need to get patients engaged. And our whole vision is to help, through this guide, to introduce connecting, engaging, and empowering patients. And we help them with checklist questions for their doctors, an action plan, and information about organizations like All County, like IPV, like other organizations for education and devices. But in answer to your question of how to get a guide, basically, if anyone sends an email to Bob S. at copdbreathestrong.org, I'll be glad to send them a digital copy or a mailed a hard copy. No problem. And we also are on Facebook, facebook.com, COPD Breathe Strong. We are a 501 nonprofit organization. I have a toll-free number that I'd be glad to help with assistance of where's a support group around me in South Florida? Where's a pulmonary rehab program around me? We want to connect people with resources. So my toll-free number is 877-396-8161. And I'd be glad to serve anybody in South Florida or Florida, for that matter. I've traveled from Pensacola to Miami to Jacksonville to Fort Myers. So I love our Florida COPD community, and I just want to serve in any way I can to help them breathe better and breathe strong.
And Bob, I have a second part of that question. The guide is great, and thank you again. I want to mention for sending it over. My question is, this is kind of piggybacking off what Ed is dealing with. Has awareness and getting people to understand been a challenge? And second part of that is PR and marketing a challenge? Because I'm a PR guy, I'll tell you. I didn't 5 years ago I had no idea what COPD was, to be honest with you, until I got into healthcare and I started talking to people about it. And then I realized, hey, I have some family members that are smokers. Maybe should have a talk with them because I don't want them to come down with this as well. So my question is, awareness and understanding, has that been a challenge? The guide's great, but in PR and marketing, has that been a challenge?
Yes. COPD and pulmonary rehab, a major treatment for it, have been referred to as the Rodney Dangerfield disease. It gets no respect.
That was great.
It reminds me so much of what Ed said earlier about what's the barrier of why more people aren't using the IPV device. A lot of it is awareness, but a lot of it is financial. And if it's perceived that let's face it, healthcare is a business, and many times what will generate more revenue, what gets more attention. Well, heart disease and cancer get a lot more attention than COPD. But if you look at it closer, you'll find that most people with COPD, there's an average of 6 other coexisting conditions, and many times they are cardiac, or they are cancer, or they are other problems. And what I've found, David, is that if you manage your COPD well and breathe better, it's going to have a positive impact on your management of your other conditions as well. So, in answer to your question, it is a challenge, but we've had great patients and providers who have forged the landmark ahead of us. And back to your original question, we're dedicating COPD Breathe Strong to the legacy of the champion patients like John Walsh, who founded the COPD Foundation and Alpha One Foundation. Nick Jones, who was a COPD patient advocate in the villages and national advocate for COPD as patients. Our providers, Dr. Thomas Petty, who was a great pulmonary doctor who helped introduce long-term oxygen therapy and pulmonary rehab. Claudia Cote, who we lost too earlier in her 40s several years ago due to cancer, was a wonderful researcher on how to do more effective treatment with pulmonary rehab and developing monitoring tools to help pulmonary rehab experts. We are following a great group of people who have dedicated to help others. And that's what Breathe Strong is. We want to connect, engage, and empower patients and providers my brother Ed and I have known each other for a long time, and we are in this together with our National Respiratory Association, with our state, with our pulmonary rehab, but most importantly with our patients. And it's an honor to have the opportunity to help serve our South Florida COPD community and the state of Florida and the United States, as we are reaching out to form these coalitions in all 50 states.
And Ed was nodding his head as you were naming those names. Ed, tell me what you were thinking.
Well, these are all people that devoted their lives to the enhancement, the promotion, the betterment of people with lung diseases. Dr. Petty, I mean, I'm sure Bob, that was the text that he wrote was the Bible for respiratory therapy students when I got into the field in 1972.
Wow.
I had the privilege of meeting Dr. Petty out in California during that era, Ed, and he had that style with a little bow tie, and he'd do his rounds throughout the hospitals in Southern California every fall. And as a respiratory therapy student, he pumped me up and motivated me.
Well, Bob and Ed, it's hard to believe we only have a minute left. Bob, probably 30 seconds. Bob, I want to thank you for coming on the program. Bob Subkobiak, a respiratory therapist, COPD Coalition Coordinator. I'll give out the info, 1-877-396-8161, COPDBreatheStrong.org. But I just found him on Facebook. Great page there, Bob, so thank you.
And the last thing
for the opportunity to join you.
The last thing I'd like to mention is if your listeners would please tune in next Tuesday night, you're going to have a very, very special guest. Her name is Jane Park, and she is the wife of a COPD patient, someone with advanced COPD, but she is also a registered nurse. So she would have some very, very interesting insights into living, with COPD.
Yeah, I just talked to her on the phone, and Bob, you'll be able to hear. You can on All County Healthcare Incorporated Facebook page. You'll be able to watch.
I'll look forward to it.
All right, thank you, South Florida, and good night. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.